Starting record and letting everybody in.
All right, welcome everyone. We'll give just a moment for everyone's audio to connect. All right, welcome everyone. Happy Friday to you all. Welcome to the emergency preparedness for the combined health impacts of extreme heat, wildfire smoke, and COVID-19. This meeting is hosted by the San Francisco Department of Public Health and supported by the Joint Information Center of the San Francisco COVID Command Center. Just a few quick housekeeping items. Audio, video, and chat will be monitored and recorded. Regarding audio and video, we respect all participants in this convening today and want to create a safe space for all. By default, all participants will be muted and video is disabled. Video will be on for speakers only. And to participate in the Q&A, please select the chat button at the bottom of your screen and submit your questions or comments to Q&A. Just a reminder that you can save lives and stop the spread of COVID-19 by getting tested for COVID-19. For more information about testing eligibility and locations, please visit sf.gov/gettestedsf, or you can also call 311. And as we approach Labor Day, remember to keep yourself and others safe. Remember to wear a face covering and be sure to wear it properly. Have safe social gatherings by keeping at least 6 feet of distance, avoiding sharing food, drinks, and common objects, and gathering outside whenever possible. And be the trusted messenger by discussing with your family and friends about how to gather safely. Thank you again for joining us. And now I will turn it over to Carmen Almeida.
Hi, good morning, everyone. My name is Carmen. I'm a public service aide with the Climate and Health Program. Today's webinar is being presented by Matt Wolf and Tiffany Rivera. As a reminder, I would just like to mention that the webinar is being recorded and we will be able to share a link with you after the event is complete. We welcome you to revisit the content yourself and share it with colleagues. We also invite your comments and questions. Please look at the Q&A chat box on your screen. And if you think of a question for the speakers at any point, just type it in there and I will be either pose it to our speakers at the time or hold it for the discussion portion at the end of the event. And then if we don't have a chance to get to your questions, just shoot us an email and that will be presented at the end of the presentation.
Thank you so much, Carmen. So thank you all for joining us today. My name is Tiffany Rivera and I'm the Deputy Director for San Francisco Department of Public Health's Emergency Preparedness and Response Branch. I have been in emergency management in this position for the past 2 years, and prior to that I was an emergency and trauma nurse for approximately 10 years. I'm very excited to be able to present this information to you all today.
And hi, my name is Matt Wolf, and I manage the San Francisco Department of Public Health's Climate and Health Program. And in that capacity, we work on identifying and trying to mitigate the health impacts of climate change. So a few months ago, we released a survey through the community branch of our emergency response team COVID emergency response team, about how the city could best support you all, the CBOs, faith-based organizations, residential care facilities, and supportive housing sites, all of the people that have been on the front line of COVID-19 response to prepare for our yearly climate-related extreme heat events and wildfire smoke events. So in that survey, 92% of the respondents said that they could use information and guidance about best practices. So this is an effort to respond to that demand. And I just want to acknowledge that between the time we scheduled this webinar and then today when we're actually hosting the webinar, that we've faced a barrage of these climate-related events. We've had extreme heat, lightning, rolling blackouts, air quality events, and this is all on top of COVID-19. So I just wanted to hold out there and acknowledge that we're a little late and that you've been working on this for weeks. And if there's one silver lining, it's that now that we've all had some experience dealing with these combined hazards, that we'll be able to go into a little bit more detail as if this was all novel, we wouldn't be able to. And the last thing before we get started is I just want to center this around climate change, and that the only way we can truly be resilient in the long run is by reducing our greenhouse gas emissions that contribute to extreme heat and wildfire smoke in the first place. And I know the San Francisco Department of Environment and a lot of our community-based organizations are hard at work on that. And I just want to say that that's the opposite side of the same coin. So next slide, please.
Thank you, Matt. So just going to give a brief overview of our presentation today. We're going to review some of San Francisco's extreme weather events. We'll be summarizing how the pandemic is disrupting our ability to respond to these events. We'll identify best practices to prepare for and respond to the health impacts of extreme heat and wildfire smoke. We'll split this section up into 3 separate areas, one for best practices for those who are managing facilities, one for those who work with the vulnerable populations, and those who operate outdoor programs. And at the end, we'll be able to list available resources. Next slide, please.
So I'm going to start with a really brief review of climate-related extreme weather in San Francisco. I know that this is something that you're all very familiar with, but I think it's great so we're all starting on the same page. And I always start these presentations with a review of the 2017 Labor Day extreme heat event, because I think that was the heat wave that made everybody, especially those who haven't been engaged at the ground level, say, extreme heat is actually a major hazard in San Francisco. So just to move back to 2017, on the Friday of Labor Day weekend, it reached 106 degrees in San Francisco, which was the hottest temperature ever recorded. And it hit 100 degrees the next day, which was only the 3rd time in history that it was 100 degrees for 2 straight days. And the health impacts in San Francisco were significant. There was a 48% increase in emergency medical calls for service, which represented by far the highest number of EMS 911 calls we got the whole year. There was a 17% increase in visits, and there were 3 deaths overall that were heat related, but more deaths overall because oftentimes deaths aren't classified as extreme heat caused, because extreme heat, as we'll talk about, causes a whole lot of other health impacts. And one of the challenges we have to responding to extreme heat in the city is that San Francisco is a city of microclimates. As you can see in the map, which is a surface temperature map, San Francisco's temperature differs wildly based on which neighborhood you're in. And another thing that makes preparedness difficult and response difficult is that often the weather reports aren't accurate. We use weather reports as our metric for when we activate, when we send out messaging, and oftentimes the weather runs hotter or colder than what will be reported. So we're always trying to thread the needle between over messaging and just inundating people with activate, 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 and not doing it enough. One of the things also is that San Francisco is particularly vulnerable to extreme heat. In 2006, there was a California statewide heat wave, and coastal communities, including San Francisco, Central Coast communities, San Francisco included, had the highest increase in hospitalizations out of anywhere in the entire state. If you go to the next slide, we'll start talking about why that is. So in San Francisco, an extreme heat day officially is 85 degrees. And historically, that's happened about 4 days a year, and it's increasing. So by the end of the century, it's supposed to happen 15 days a year. And extreme heat causes direct health impacts, like severe impacts, including heat stroke, dehydration, all the way down to heat cramps, heat rash, but also extreme heat amplifies other health impacts. It's a threat multiplier. So that includes, it can exacerbate kidney disease and renal disease, asthma and respiratory illness, cardiovascular illness and heart disease, allergies, diabetes, and it has mental health impacts. And San Francisco is particularly vulnerable to the health impacts of extreme heat. We like to look at vulnerability in 3 different categories: exposure, sensitivity, and adaptive capacity. So exposure, San Francisco is particularly vulnerable because most of our extreme heat health impacts happen indoors. We don't have a lot of air conditioning. We have one of the lowest amounts of air conditioning per capita out of any city in the United States. And the air conditioning we do have isn't distributed equitably. Certain communities have access to air conditioning and certain communities don't have access to air conditioning. We also have increased exposure because we have a large population of people experiencing homelessness that are exposed to extreme heat. Sensitivity, we're talking about if 2 people were exposed evenly, one might be more sensitive to extreme heat. So populations that are particularly sensitive to extreme heat include older adults who dehydrate more quickly and are more likely to have pre-existing health conditions, children who have decreased sweating capacity and are less likely to identify the signs of heat-related illness, and then people with pre-existing medical conditions. COPD affects your ability to thermoregulate. Diabetes affects your ability to regulate temperature. Cardiovascular illnesses and conditions because your heart pumps blood to cool itself. And then people who are on certain medications like diuretics or medications that increase sweat, lower medications that lower blood pressure. Some Parkinson's medications reduce sweating, and a lot of antipsychotic medications can hamper the brain's ability to regulate temperature. And then the last thing that affects vulnerability is adaptive capacity, and that's your ability to respond to the hazard. And that includes primarily social cohesion. Do you have a network of people to check up on you? Do you live alone? But then it's also access to resources. And a lot of things affect your access to resource, including your race, your immigration status, income, education, the language you speak, and then your ability to prepare and respond, which is your cognitive or physical disabilities.
So I'll be discussing a little bit on the emergency management aspect of things. So typically during a heat event, our normal preparedness and response actions consist of a couple of different things. We will provide messaging and information and guidance through social media, media outlets, messages through SF Alert. And we work very closely with the PIOs, the public information officers at the Department of Emergency Management around that. We recommend that people who cannot mitigate heat in their homes go somewhere cool. So typically we say go to malls or shopping centers, go to movie theaters, go to a local pool, go visit a family or friend who has air conditioning. We may recommend wellness checks. And this is something that CBOs can provide to their clients. And then also we recommend cooling centers, which we'll discuss a little bit more later. But we're just going to give you guys a little bit of a comparison of how emergency management is being affected by COVID. So these are things that we would typically do, but because of COVID, we may have some challenges, and we'll discuss that a little bit later. Next slide.
So now we're going to pivot to wildfire events and wildfire smoke events, which we're all very familiar with now. So just to bring it back to 2018, a deadly wildfire in Butte County coincided with Diablo winds, which we have in October and November that blow wind from east to west. So during this Diablo wind event, it took all of the smoke from the Sierra wildfire and funneled it through the Delta into the San Francisco Bay Area. And there was a high pressure system that sat off the coast, which means the wildfire smoke was just trapped over the bay. San Francisco's AQI was over 150, which is unhealthy, for 12 straight days, peaking at 228. And if we go to the next slide, once again, wildfire smoke events are climate related, and the only long-term way to achieve resilience is to reduce our greenhouse gas emissions. This is not supposed to be a yearly occurrence. We're not supposed to have wildfire season, and it feels a little insane to me. So how does climate change affect wildfire smoke? There's hotter temperatures, which causes dried conditions. There's less precipitation and longer droughts, which can kill trees. There's invasive species. So we have invasive species that move north as the climate gets warmer, which can kill trees. And then there's also, like we saw this year, summer storms that can cause lightning storms. The health impacts of wildfire smoke range from irritation and inflammation, such as dry skin, itchy eyes, mild cough, headaches, tiredness, to significant health impacts, which include chest pain or heart palpitations, asthma attacks, or difficulty breathing. People that are particularly vulnerable to the health impacts of wildfire smoke, once again, exposure, sensitivity, and adaptive capacity. Exposure includes unsheltered populations, people experiencing homelessness, people who have to work outside, and people without access to ventilation or in poor quality housing. Once again, access to ventilation is not evenly distributed and not equitably distributed throughout San Francisco. Sensitivity, the most sensitive populations include children who have a high rate of breathing and their lungs are still developing, older adults who are more likely to have pre-existing health conditions, and then the people with pre-existing health conditions, cardiovascular conditions, respiratory conditions, including COPD, emphysema, and asthma, and then pregnant women. There's some data that wildfire smoke can affect fetal development. Lastly, adaptive capacity, similar to the last slide, which is your ability to adapt to these events, is affected by social cohesion, your access to resources, race, immigration status, income, education, and language.
So back to the emergency management aspect of this, typically we would, again, send out information, we would disseminate information via media, Alert SF, and use our pre-established lines of communications, particularly with community-based organizations. We would provide information on how to identify heat illness and injury. We would again recommend wellness checks at certain times, provide best practices on how to reduce exposure in homes and how to make cleaner air rooms. We would recommend cleaner air centers be opened, and we would also provide masking recommendations specifically around N95s. Next slide. So it goes without saying that this global pandemic is disrupting our ability to prepare and respond to these extreme weather events. COVID-19 just makes health impacts worse all around. People are being exposed to elements in a different way because routines have changed. They've been altered due to shelter in place and due to social distancing. Due to the ability to decrease COVID-19 transmission, many group services are now being conducted outside. This makes it difficult to mitigate poor air quality health impacts. At the same time, we are also sheltered in place. People are being asked to not leave unless they are going out for essential business. Schools have been canceled, people are working from home or unemployed, or they're actively being quarantined and isolated. And this is making it difficult to mitigate heat in certain demographics, populations. There's also less access to cooling spaces and to cleaner air spaces. The places we would normally send people to, malls, movie theaters, pools, having the ability to go visit friends or family who may have air conditioning, those aren't options anymore. So the other thing is people are more sensitive health-wise to things. So there's this overlap in vulnerable populations. As you can see from Matt's slides, the definitions of people most vulnerable to heat and poor air health impacts are also the same group of people that are most impacted by COVID. Extreme heat and wildfire smoke could exacerbate COVID-19 impacts, but the full effects of this are still not known, as are a lot of things around COVID. COVID is also making it more difficult to prepare and respond. So the social networks that we usually use to disseminate information have been disrupted. It's making it more difficult to get information around. Community organizations that may normally assist with mitigating efforts or disseminating information are operating at or beyond capacity and are unable to, or some of them are unable to operate at all. There are resource constraints for everyone. Everyone is dealing with economic pressures. Poor staffing is an issue everywhere we turn. We even have constraints around things like disinfectants or N95 masks. And it will be very challenging for the region to message to the public about N95 respirator mask usage when we are actively trying to maintain enough stock for the healthcare workers. And then everyone's exhausted, right? Just general exhaustion. Everyone's tired, overworked, essential employees. again, due to staffing issues. There's a lot of emotional exhaustion from social and political issues that are happening at this time. And then just the general strains on mental health due to isolation due to the pandemic. In addition to all this, we are yet unable to appropriately assess the health impacts and risks of these combined hazards. Next slide, please. So this is one of our biggest challenges. Many of the best practices that we typically recommend to prepare or respond to these hazards may actually increase the risk of another hazard. So for example, there are times when the best practices to reduce exposure to heat or wildfire smoke may actually increase the risk of COVID-19. This is the case with guidance around ventilation and fan usage, masking guidance, or even about whether or not to open windows. We've received questions about how to prioritize these hazards, and unfortunately, there's not a one-size-fits-all method to weigh these risks. It all depends on the severity of the hazard and the vulnerability of the population that we are protecting. For example, a decision might be made differently if it's 90 degrees versus 105 degrees outside, or if we're discussing a senior center versus a childcare facility. What we can say is that in our data, extreme heat causes more short-term, or in that short period of time that we have these extreme heat events, we have more hospitalizations and more deaths on average than we would if it was due to exposure to wildfire smoke, even though wildfire smoke events tend to last a lot longer. Because of this, you might see messaging that is centered around harm reduction as opposed to clear directives. So decisions will really have to be made on how to decrease harm. We know that this is not very directive guidance, and we're going to get into some more specifics as we go over the best practices. Again, if you have any questions regarding this, please enter them in the chat and we'll try to get to them during the Q&A section. And if we cannot answer them, we'll discuss with our information and guidance team and get back to you individually. Next slide, please.
So we're going to transition a little bit in from kind of an overview into more specific best practices to prepare for and respond to extreme heat and wildfire smoke. And we've divided these best practices into 3 different categories. One for people who manage indoor spaces, one for people who work with vulnerable populations, and one for people who work outside. And we understand that many of you span all or 2 or 3 of those categories. I also want to just make mention that we have compiled all the resources that we're going to mention here. We're going to talk about a lot of different resources, and they're all on the website sfclimatehealth.org, which will be in the chat. If you click right at the top, basically I've just made a table that links to every resource, a lot of them which were developed by San Francisco Information and Guidance, a lot of them from the EPA, and so you'll have them all in one place. So we're going to start with resources of people who manage indoor spaces during extreme heat events, and the first thing is, how do you monitor temperatures? And I think one of the important things to learn here is heat waves last longer indoors than outdoors. There's been a lot of research on this where they measure temperatures, and it takes a long time for buildings to cool off. So remain vigilant even after the heat wave may have broken outside. And this is especially important for people who manage housing. Also, it's important to know that heat may be uneven throughout the buildings. So top floors might be hotter than bottom floors. Rooms with large south-facing windows might be more warm, and also rooms with poor airflow. And a lot of you know this just from your experience being in these buildings. And so then the next question is, okay, I've assessed these temperatures, I've monitored the temperatures, what am I looking for? What is safe and what is not safe? And once again, there's no hard and fast rule on what is and what isn't safe. A lot of it is based on how the person feels in that specific room or in that specific environment. The best proxy we have to kind of answer that question is from Cal-OSH, which is the California Occupational Safety and Health. And this is a department that is to protect workers, not residents, workers. But they've created some thresholds about safety for these employees. And what they say is that extreme heat mitigation activities inside workplaces should begin when the temperature equals or exceeds 82 degrees. And so we're going to, in the future, get into what some of those heat mitigation activities are. And a link to the Cal-OSH guidance about what those might be is available in the resource sheet. So next slide. So you've monitored temperatures. So the next is, how do you cool? your actual spaces. And so here's just some very simple solutions. Windows are a significant source of indoor heat gain. Being able to reduce heat entering the building through windows is just a really efficient way to keep spaces cooler. So one of the easy ways to do that, that's kind of a long-term strategy, is permanent window shading, like outside, to block direct access to sun. But in the interim, you can do window tinting. You can purchase blackout curtains, blinds, or shades. And we recommend opening these at night and closing them during the heat of the day. And once again, this is more difficult to do during an air quality event, but the data does show that heat is a more significant short-term health threat than air quality. Also, I think that it's important that if you are opening windows at night, that you practice window safety. We've seen an uptick in people falling out of windows during heat events, and it's important to just make sure that children are kept away from these. For those of you who manage housing in individual rooms, AC units, or if you have AC units or window units in individual rooms, make sure residents are trained on how to install, use, and maintain these units. And fans are fine for individual rooms, but may be ineffective or dangerous at really high temperatures. Fans can dehydrate you. So if the indoor temperatures get over like the low 90s, fans may do more harm than good. So one of the things that we've gotten a lot of questions about is what to do in congregate cool spaces. So what do you do in spaces where there are multiple people? In these spaces where there's multiple people, air conditioning units are preferable. And once again, if you're using air conditioning units, make sure people are trained on how to install, use, and maintain them. And if you don't have an air conditioning unit in a congregate space and you want to make an informal cooling site, you can try to optimize ventilation by using ceiling fans with an upward airflow mode to push up air and then to open windows. And then either way, we would like this. I think the best practice is to pair this with an air filtration unit. A lot of this congregate cooling information is right now being assessed by our city attorney's office, and it will be released very soon on our website, SF72. And I'll also update the resource sheet on SF Climate Health. In congregate settings, though, fan usage can spread droplets further. So if you have normal floor fans, they can spread droplets, which can increase the spread of COVID. And fans need to be used to mitigate heat, make sure that they're not pointed at other people, and that everybody inside the congregate space is using face covering, maintaining social distancing, or has appropriate hand and cough hygiene. And once again, we are going to make this information, once it becomes official and it's done with review, available to you all, and we'll make sure to follow up with you. The city will also consider, during extreme heat events, when the temperature is forecasted to be over 86 for several days, opening congregate cooling centers. We've reached out to people around this, and this would be publicly available cooling spaces for the general public. And we're still kind of working through the details of what this is going to look like. But when they're open, we will message this out on SF72 and do our best to communicate them through our established communication channels. So next slide, we're going to pivot to air quality. So what do you do to prepare indoor spaces for wildfire smoke events? So the first thing is for buildings with air filtration or HVAC systems. This is the gold standard, especially if you have MERV 13, which is the MERV filtration that is best able to filter out wildfire smoke, because wildfire smoke particulate matter is very small. Make sure if you have this gold standard that you clean the filters before wildfire smoke season, and that you have spare filters available. They go through really fast when the air is this dirty. If you don't have air filtration and you manage a space for a person or family unit, like if you're in housing management, you can create cleaner air rooms. So this is something that the EPA has a lot of information on, and we have a link to it on sfclimatehealth.org in the resource sheet. And it's ways, and basically to create a cleaner air room, you prevent smoke from entering the room. So you close doors and windows, you keep the room cool, so fans, as long as there's also not a heat event, and you filter the air in the room if you have access to a portable air filter to make sure one room is clean. For congregate spaces where there's going to be multiple people who wish to ventilate, the city has released information and guidance on how to operate a cleaner air center. And this is available in our COVID-19 portal. Also, we have a link to this guidance on SF Climate Health in the same resource sheet. And this guidance basically says that facilities that wish to act as public spaces where people can seek relief from wildfire smoke, this is going to be like kind of how to balance cleaner air and COVID safety and some ventilation guidance. We don't recommend cleaner air sites for the public in buildings without HVAC systems, and when possible, set HVAC systems to minimize but not eliminate fresh air intake. And then open for the public, we're going to consider opening cleaner air centers at particulate matter of 201 or above for a sustained period of time. And we're collaborating with CBOs around this as well. And I know that there's going to be some nuanced questions that you have around when to, what ventilation requirements to use during an air quality event with respect to COVID ventilation requirements. And we're going to try to get to that in the question and answer portion of this presentation. And so I'll throw it to Tiffany for the next slide.
Great, thank you. Next slide, there we go. So how do you best help your clients if you work directly with vulnerable populations during extreme heat events? Some of the best practices to avoid heat-related health impacts are to obviously hydrate with water, preferably, or low sugar electrolyte drinks. Avoid diuretics like caffeine, alcohol, soda. These are drinks that increase urinary output and can lead to hydration. Wear light-colored clothing and hats when outside. Use sunscreen. Make a plan for your medications. Medications can be less effective if they're exposed to heat for a long time. So ensuring that they are stored in appropriate temperatures is best practice. Some medications actually increase the risk of heat-related illnesses. And so it's always good just to remind your clients of this, even if you don't know what medications they're taking. And if they have any questions around that, then you can just always point them towards their primary care physician or their nurse advice line. So another thing that we typically recommend is to just simply take showers to cool off, or using cold compresses or ice to cool off. One option is the ability to provide wellness checks via phone. We have piloted this wellness check process with the Richmond Senior Center last year during heat events, and we've received their feedback and made some changes, and have had the chance to develop a safe, non-clinical way for organizations to check in on their clients. During heat events, we would typically recommend this at 91 degrees or above for a sustained period of time. If you're interested in learning more about that, please provide your name and contact information in the chat box, and we'll reach out to you. All of these tips would be available on sf72.org during an extreme heat event. And you would also receive messaging via Alert SF if we are in an extreme heat event. Next slide, please. So we're going to briefly review how to identify heat-related illnesses. Heat has cognitive impacts and could make people less able to assess themselves. Heat illness and dehydration does have a tendency to cause confusion, especially in the elderly population. So they may not realize that they're suffering from this, and it's just important to stay vigilant about this when working with these clients. There are varying degrees of heat illness, and the infographic on the right of the slide shows signs and symptoms of both heat exhaustion and heat stroke. And these are one of the infographics that we provide with our info and guidance typically when we have these heat events. So you start off with heat exhaustion, which symptoms can typically include dizziness, excessive sweating, cool, pale, clammy skin, nausea and vomiting, rapid pulse, muscle cramps. If clients state that they're having any of these symptoms, you can just ask them to hydrate, drink water, take cold showers or cold compresses to cool off, and definitely recommend that they contact their primary care physician. If we currently have, during that time, cooling centers available, then we would suggest that you recommend that they go to cooling centers. And like Matt said, that information will be listed on sf72.org. So heat stroke symptoms may include all the previous symptoms, but also have some more severe ones, such as a throbbing headache. They've potentially stopped sweating because they're so dehydrated that their bodies just don't have the fluid to actually sweat anymore. Their skin may be hot to the touch, and sometimes they may even lose consciousness. For these symptoms, it is best to just call 911. And just one other tip is just to make sure never to try to hydrate someone by giving them water, pouring water down their throat if they're in and out of consciousness or have lost consciousness completely, as this can cause them to choke. Next slide, please. So messages that we typically share during wildfire smoke events. Typically, the thing that we push the most is to stay inside. This, of course, comes along with the caveat of as long as it's not too hot inside, as heat does take precedence and does have a tendency to have worse health impacts. So staying inside is the best thing that you can do during wildfire smoke events. We would like to be best to remind clients to refill medications before air quality events happen, especially if they suffer from respiratory illnesses. We ask that avoid activities that cause indoor air pollution, such as frying food, using candles, vacuuming, smoking indoors. These are all things that will increase indoor air pollution and can just provide make more of a problem. We have links and guidance to how to develop clean air rooms, as Matt mentioned earlier. We recommend when these wildfire smoke events happen, we do push out masking information. And we'll get into that a little bit more on one of the following slides, but we do want to say that cloth masks do not protect against particulate matter. So the face masks that we're currently using and must continue using due to COVID don't do anything to protect from wildfire smoke. And the other thing that we really push is that if you do have access to an N95, but you feel unwell wearing it if you're outside, to take it off immediately. And like I said, we'll go into a little bit more details in that in one of the following slides. We provide guidance on how to identify and treat air quality related illness. Some symptoms that you might see are coughing, stinging eyes, scratchy throat, runny nose, that kind of thing. And the way to treat this is by limiting exposure to the poor air and by staying inside. And then there are medications to manage symptoms, but if they're just more like allergy medications, but we suggest that clients reach out to the primary care physicians in order to get that information. There are more serious symptoms like severe asthma attacks, severe shortness of breath, dizziness, chest pain or palpitations, and those are things that really need emergency assistance and should have 911 called. We also would recommend providing wellness checks during air quality events, but we would typically recommend this at levels of particulate matter of 201 or what is considered to be very unhealthy air. And more of that information, if you are interested in those wellness checks, just let us know in the chat box and we'll try to get a hold of you. We would provide links to cleaner air centers if available, and again, that would be on sf72.org. And if you would like to track the air quality on your own, you just go to airnow.gov.org. I don't remember if it's .org or .gov, but it's an EPA website that provides updates on the air quality. At certain levels, we do distribute N95s to persons experiencing homelessness. There are many city agencies that are doing this, as well as our street medicine teams. And if at any time you identify someone who is a person who's experiencing homelessness, who's in need of any kind of assistance, you can always call 311 and identify the person, and they can connect with resources. Next slide, please.
All right, so our last section is going to be on best practices for people who operate outside. I know a lot of people have moved services from primarily inside to primarily outside based on information and guidance around how to reduce the spread of COVID-19. And that makes outdoor spaces more vulnerable to exposure from extreme weather events, of course. So what do you do during extreme heat events? The most simple thing is to cool outdoor spaces. So you can do this through shade structures, a tent, or misters, and especially if there's people that are waiting in line at your site, that would be something that would be really helpful. I think there's been a lot of, because those people are at increased exposure. And then the second thing is protect clients and staff. So once again, CalOSH, Occupational Safety and Health, has developed guidance for outdoor employees. And so this guidance, once again, is for employees, but it's based on how a organization can best protect their employees from extreme temperatures. And we have a link to this in the resource sheet, but these kick in once it hits about 80 degrees. And certain things that organizations could do includes providing water to people who are outside, frequent breaks, rotating people in and out, and access to cool spaces or cold compresses. And so I think it's just important to have that on hand to adapt your organization if an extreme heat event was to happen. Yeah, and next slide.
And that's stuff that we've definitely had to do with the alternate testing sites that we have throughout the city for COVID. A lot of them have walk-up sites and where people are waiting outside in the environment. And so that is one of the things that we've been able to do is to, from the city perspective, is provide water and shade structures to some of these testing sites. So next, best practices for those who are operating outside during wildfire smoke events. CalOSH has similar guidance for employees during wildfire smoke events. One thing to keep in mind is that regardless of the particular matter level, we can be anywhere from, just unhealthy for sensitive to very unhealthy for all. That you may see vulnerable populations, elderly people or people with pulmonary or cardiac disease that may develop symptoms no matter where we are in the spectrum. But CalOSH's guidance does start with more prescriptive guidance beginning at 151 particulate matter. And that at this point, they say that masks must be offered to outdoor essential workers. And so if there are workers who are not essential but are outdoor workers, at this point, you would want to redeploy them redeploy them elsewhere and make sure that they're not working outside. At this time, there should only be outdoor essential workers that are outdoor, and masks must be provided. It's voluntary, and so you wouldn't necessarily, they're not forced to wear the masks, but as an employer, you'd have to offer them at least. And so this is kind of where we base some of our guidance here in the city. Above 201, you would postpone all non-essential work and send people, postpone non-essential outdoor work, and redirect workers indoors only if they can maintain proper COVID guidance. And this is where things get very difficult. There's a reason why people have moved from inside out. And so if you cannot maintain that guidance and those standards, the COVID standards, by returning indoors, then essentially it's a sign that you may have to postpone operations. At particular matter of 301 and above, it is mandatory by CalOSH to send all non-essential people home. So we do not have the ability to recommend, as a city, we don't have the ability to recommend shutting down outdoor activities. But what we would do is Department of Public Health would consider sending out an outdoor health advisory to the community, just stating the health impacts and letting the community make that decision on their own as to whether they should maintain outdoor activities. And that would actually usually happen around particulate matter levels of 210. So regarding N95s and masking, first and foremost, we must follow all face covering guidelines based on COVID-19. We're never going to distract from that messaging. But masks of any kind are not a substitution for staying indoors during wildfire smoke. N95s with two-way valves are not safe for COVID. These can be used if there's an additional face covering or mask that is used in conjunction that covers the vent. But these are one-way masks, so you can breathe a little bit easier in them, but when you exhale, you're exhaling particles out into the community and to people around you. And so for that reason, they are not acceptable COVID masks. Simple masks and cloth face coverings, the ones that we've been using mainly for COVID guide response, is they do, like I said earlier, they do nothing to mitigate poor air quality, unfortunately. But it is still mandatory that we have at least that when you go outside. If you have access to an N95 and feel comfortable wearing them, then those are okay. But we do know that N95s can be dangerous for people with cardiopulmonary disease. It actually increases the work of breathing. That can be very detrimental to certain populations. So if someone feels worse wearing an N95 mask, make sure they take it off. And it's also important to follow manufacturer's fitting guidance. Wearing an ill-fitting mask will provide a false sense of security, of protection from the smoke. And of course, for that same reason, N95 masks do not work for children. There are not appropriate sizes for children. And they do also not work for people with facial hair. Next slide, please.
Okay, so I'm just going to go really briefly over this so we can get to the question and answer portion. All of these resources, this exact resource sheet will be available on sfclimatehealth.org. If you go to the very top, there'll be a big sign that says click here for resource sheet. If you click there, you'll get this resource sheet, which will have links to everything we discussed in this presentation. And I think our plan is to be continuously updating this as more information gets developed. Next slide. Great. So I think we are done with the presentation portion, and we have about 15 minutes for a question and answer. So if people had any questions that are more specific on best practices, please ask that, type that into the chat box, and then Carmen will be elevating that to Tiffany and myself.
So the first question comes from Adriana Argueta, and she's asking about when to shut down the school or move activities inside, and generally whether COVID-19 ventilation requirements such as air exchange, open windows exist during wildfire smoke events.
Thanks. We've actually gotten that question a couple times so far, and I think this is one of the most balancing acts, is that what do you do when you have two mutually exclusive requirements? So one says, basically for COVID-19, air exchange is really important. For wildfire smoke, recirculating air is important. And so this is, I'm just going to read this word for word. This is what was developed by our information and guidance team, which has done just so much great work on helping us think through this and do a lot of research about what is the safest method. The information and guidance team says to minimize the risk of COVID-19, offices, childcare programs, and out of school time programs and other businesses have been directed to increase ventilation of indoor spaces to the extent possible by, for example, opening windows or changing their air conditioning settings. These entities are not required to close if they now need to shut windows or adjust their ventilation systems to minimize exposure to wildfire smoke. Childcare centers and youth programs, also known as OST programs, may move activities indoors if the AQI is unhealthy. Whenever ventilation is reduced by closing windows or reducing outdoor air intake, entities and individuals should be particularly mindful of precautions to reduce transmission of COVID-19. Wash and sanitize hands, frequently follow all face covering and physical distance requirements, clean frequently touch surfaces and items regularly, and remind everyone that can work remotely to do so. And so this information is subject to change and is all available on sf72.org. One of the other things that we've gotten a couple questions of, and is about the difference between EPA Air Now and Purple Air. So there's two general ways to measure air quality, and we're talking about AQIs and everything. So it's just good to have some knowledge on what Air Now and Purple Air mean. Purple Air is based on crowdsourced individual air sensors that are in people's homes. And so they're real-time air sensors. So if you look on an Purple Air map and you see something is a AQI, that is really what the AQI is right next to that sensor. The thing is, those sensors aren't as well regulated. So those sensors may be in a garage, they may be on the top of the house, they may be next to a freeway, and they're really valuable for the people that are right next to that sensor, but they're less maintained. The other thing is, because they're real time, if a truck drives by that sensor, the sensor might show that air quality gets a lot worse and then a lot better. EPA Air Now sensors, they're modeled, and what they do is they take basically an average over the course of an hour. And so it's a rolling average. So it's more normalized. So you'll see less fluctuations in EPA air now sensors than you will in purple air sensors. But the EPA air now sensors are maintained by the EPA and are all done in a very standardized way.
Right,
On the
thanks, Matt.
question regarding schools, we don't have a specific response, like at a specific response level where we would close schools down. We would consider them towards the higher end of the unhealthy air. It's something that, again, there's so many things that go into making those decisions based on the severity, how long it's expected to last, that we don't have a set time at which point we would close them. But it is something that we consider and take into consideration as a region, not just based on the city and county of San Francisco. So I apologize, I can't answer that question. Carmen, I was provided one question by the JIC, so I'm just gonna run off real quick. It was directed towards me specifically.
Yeah.
It's saying directions around protecting workers from wildfire smoke say that if the air quality is 151 or higher, you're supposed to take reasonable steps to reduce exposure. If you cannot reduce exposure, as in there's not enough filtration, can you keep employees working? I mean, I'm gonna go ahead and just point you towards the Cal OSHA guidance on that, and that it will be available on the website. This is again, the guidance Cal OSHA provides is not our specialty, but it is something that we are providing here. But above 151, like I stated, it does state that there should be voluntary use respirators must be offered to employees if you can't provide a decrease in exposure. And then postponing of all non-essential strenuous work at 151. And then from there on up, the response increases. So I hope that answers your question.
So another question comes from Leslie Cupper. The question is the reason for doing well checks via phone because of COVID? And what do you do if your vulnerable people don't have phones?
Sorry, can you ask the question one more time, Carmen?
Is the reason for doing wellness checks via phone because of COVID? And what do you do if your vulnerable people don't have phones?
Oh, that's a great question. Thank you. So I think that what we try to do is provide information and guidance and plans on wellness checks at varying levels. And so the reason that we've started with phone check-ins is because it's more feasible to do. People may not have cell phones, but the majority of the population has a landline or a way to get in contact. And typically, community-based organizations will have this contact information for their clients. So that's the reason we've always planned it as phone check-ins, even prior to COVID. And that actually kind of helps us in the time of COVID, so we don't actually have to do face-to-face check-ins. We find that face-to-face check-ins are going to be a lot more resource intensive. And so although we do have plans for that in extreme situations, like for a big earthquake or for potentially the PG&E public safety power shutoffs, where people might not actually have the ability to have phones. For things like air quality and heat, we have started with the phone check-in. And so for people who do not have access to phones, we would hope that the information we disseminate through the community and gets to them somehow, gets to them verbally or through other means.
And a follow-up question also from Leslie is, for people with respiratory disorders, is heat still a greater concern than poor air quality?
Yes. It depends. Again, it's not a one-size-fits-all kind of thing. So someone who has severe, respiratory illnesses may, and they have the ability to mitigate heat, may respond differently to really poor air quality. They may respond worse to air quality than to heat. So it's all a case-by-case basis. But what we can say is that heat has a tendency to, has greater health impacts than air quality would. Matt, did you want to add anything?
Yeah, I wanted to add in a couple of things. One is just to highlight that it's a case-by-case basis. We're not saying that for everyone, heat is more severe than air quality. We're just saying that if you look at in aggregate the population totals, we see more health impacts at heat, we see more hospitalizations at heat. That's not to say that we don't see some at air quality that are very severe for some people. It's just heat is the one that that's borne out by the data. The second thing is that oftentimes heat events and air quality events are not mutually exclusive. When it gets really, really hot, it accelerates the creation of smog. So you actually see a lot of our extreme heat events are also air quality events. So, yay. But I think that that's important to hold too. And also the last thing is that there are respiratory impacts to just heat in general as well that are individual then to air quality.
Great. So our other question comes from Jill Spazzano. How are you addressing the alert messaging for people who don't have access to internet or smart devices? In our last fire event last year, we all lost internet towers. Do you feel that this issue has been addressed?
That is a question more for the Department of Emergency Management and the JIC. So that's something we can get back to you, Carmen, if we can take note of that.
Yeah.
Thank you. That's it's more of the alert SF and those message capabilities are not Department of Public Health specifically. They go through the Department of Emergency Management. But like I did say earlier, Department of Public Health does disseminate information via email to community-based organizations, and then we hope that they get it out to people who may not have access to that in times where we may not have electricity. For example, like you said, the wildfires and the surrounding areas, if electricity and internet service goes down, it just complicates the situation. And again, we can try to find out what the official plan is from the Department of Emergency Management.
We've also, sorry, Carmen, we've also developed tip sheets there's tip sheets that SF72 and DPH and the JIC have all worked on around how to stay safe from wildfire smoke and extreme heat. And I know this isn't like alert, there's a wildfire smoke event right now, but this is more about how to prepare and respond to these events. And that's available on sf72.org, and they're translated. And there's a link to them in the resource sheet on SF Climate Health. And I think one of the is that can be used to distribute to people who don't have access to, it can be printed as a poster or to people.
Yeah, and I think providing this information in preparation mode before these events happen is the biggest thing we can do to mitigate any issues, if we then find that we don't have access to internet or electricity.
All right, so our next question comes from Michael Liao. It seems that the AQI number and the associated color and label differs depending on the source. Can you clarify, for example, using my AccuWeather app, the current local AQI of 71 is considered poor and rated as orange, but from most other sites, anything 100 and below is considered moderate and rated as yellow?
I think we as a city and as government entities, we use the EPA one. And to my knowledge, they've all been very, very similar. I haven't had any experiences where they've been off, because I think that we're all meant to follow a very, guidance that is very, that is similar or say the same throughout. Matt, do you know anything about that?
Yeah, I mean, I can just say we use the ones that are on the EPA Air Now. So 0 to 50 is very good. 50 to 100 is yellow, which I forget what yellow is, but 100 to 150 is unsafe for certain groups. Moderate is 150 to 200 is unhealthy. 200 to 300 is purple, and that's very unhealthy. And 300 plus is maroon, and that's hazardous. So I know that that's how we've been using it, and that's what our emergency response plan uses, those thresholds to guide our activation.
And Purple Air and EPA Air now use the same thresholds as well. So those are the ones that we typically use, and those are the ones that our plans are based off of.
And Michael also posed a follow-up question. It also seems like there are not a lot of air quality trackers throughout the Bay Area. The AQI data that is obtained usually seems to be from the closest air quality sensor or assessment site. Due to the microclimate mentioned, what might be the best way to assess localized air quality for your area? Is it safe to just use the smell test? Do I smell smoke versus do I don't smell smoke?
I think the smell test is helpful. I don't know if that's actual official guidance that we can provide. There is only one air sensor in the city of San Francisco, which is crazy considering all the microclimates. They are extremely expensive to maintain and difficult to maintain is my understanding, and to keep calibrated. And there is a push to increase those sensors in the city. Unclear if that is something that can happen or not. You know, I think a lot of people have gone to Purple Air for that reason. Although there are reasons why, you know, we had to take the information on Purple Air with a grain of salt. Matt, did you have anything you wanted to add to that?
Yeah, I was going to say that one of the things to just learn about the smell test is that oftentimes things can smell like poor air quality or look like poor air quality, but it not actually be poor air quality. If I wanted to get into it, sometimes the smoke is really, really high. And so it could look really brown and you might see ash, but it's not actually the air now isn't that bad. And so I think that one of the struggles that exists in wildfire smoke events is that it's really apocalyptic looking. And, you know, and that's real. It's terrifying and it looks scary out there. But not always is that reflected in the AQI. I think that one thing to remember is that we have modeled data in San Francisco, so it doesn't account for our microclimates at all, but it is more accurate if you're going to look at it from, you know, an hour to hour as opposed to minute, then I think, I'm not going to say more accurate, but a different thing than the Purple Air ones. The Purple Air ones are more like, what is the minute-to-minute air quality in this specific spot? I think that generally the AQI is the AirNow AQI is a really good proxy for what the air quality actually is. That is to say that because it smells bad and because it looks bad, that's not to say that there aren't a whole lot of other nuisances or impacts that you can have from being exposed to that. So I don't want to minimize that at all. But I think the real breathing in of bad particulate matter happens kind of when the EPA AirNow says it happens.
Our next question comes from Tim Costigan. Yes, there's a lot of confusion around Air Now and Purple Air AQI discrepancies. Can you explain the need to use the LRAPA wood smoke adjustment when using Purple Air?
So I personally cannot answer this question. I'm not sure if Matt can, but I did want to say that just looking at a time check, this will be our last question. And if there's anything else that can be, it needs to be asked, please put it in the chat box and we'll get back to you individually. Matt, do you have an answer for that?
I don't know. I would be very excited to go down a rabbit hole and read all about that. I think and I would, if Carmen, you give me the email address, I can send that response out. I think that one of the things is there hasn't been really good messaging around the difference between Purple Air and Air Now. And I think that that's something that I know that a lot of our regional public sector entities are working with, is how to both understand that Purple Air has a really great purpose to measure individual air quality, but at the same time, for like an overall large scale planning, it's something that is more managed, like Air Now does, fills that gap. And so what I would do, I would be really happy to respond to that, Carmen, if you give me.
Okay. Yeah.
Great. Thank you all for those questions, and thank you for for helping us out with that. Matt, did you have anything in closing before we turn it back over to Becky?
Yeah, I think my last thing is that this is, we're all learning this at the same time, and we really appreciate all of the work that you're doing to respond. This is like, this is like such a barrage of these different climate related hazards, and the stuff you guys are doing is really admirable. And I know that Tiffany and I have learned a lot, and we are better able to do our work the more that we hear from you guys, because my job and Tiffany's job is to respond to your needs in a lot of ways. And so just if you have questions, let us know. We will work to get those questions answered, and just thank you for doing the work you do.
Thank you guys so much.
Great. Thank you again, everyone, for joining us for this meeting on emergency preparedness for the combined health impacts of extreme heat, wildfire smoke, and COVID-19. And again, the email addresses that you can use for additional information are below. Thank you again for joining us, and have a great weekend. Stay safe out there.